I'm Abby Stanley, and today I'm going to talk to you about visual inspection with acetic acid. What is visual inspection with acetic acid? Well, it is also known as VIA or VIAA, and it is a cervical cancer screening method. The products that are needed for this method are acetic acid, which is simply vinegar, cotton swabs, and a light source. So before we dive into what VIA is, we need to have a good understanding of what cervical cancer is. Cancer is the uncontrolled division of abnormal cells. This is also paired with their ability to invade tissue. So over here we have the female reproductive tract, and what we're looking at is the zone of transformation. That's right here. This is the cervix. So we're looking for abnormal changes that happen to these cells. So cancer progresses from abnormal cells, but it is important to recognize that abnormal cells are not cancer. Cancer can also be caused by HPV, which is human papillomavirus. The virus infects the cells of the cervix and incorporates its DNA into those cells, and then those cells divide uncontrollably and cause cancer or become cancerous. Over here we're looking at a cervix, and you'll notice down here that there's low-grade CIN and high-grade CIN. CIN is cervical intraepithelia neoplasia. Neoplasia roots from the word dysplasia, which dysplasia is simply an abnormal lesion of cells that can be seen on a biopsy. So we're looking over here and we see this healthy peak tissue. As we move down to the low-grade CIN, it becomes more abnormal, but it's still pretty mild. And then the high grade is becoming more increasingly abnormal. And then cancer, of course, is extremely abnormal, and you can visually see that right here. So how VIA works is the cervix is washed with acetic acid, and then the observer will view with their naked eye some changes that may occur to the cervix. It only takes about a minute for this reaction to occur. The abnormal cells react with the acid and produce a whitish appearance. So over here you have a cervix that hasn't been treated yet. And then we look over here in this one, you can see these whitish lesions. Those cells are abnormal and they reacted with that acid. So that's what we're looking for with this test. Some advantages of VIA are that it is low in cost. We all know that we can go to the supermarket and buy vinegar in a bottle, and it's not very expensive at all. There are immediate results. This is important in the clinical setting because a lot of times patients are lost to follow-up because they don't ever come back to see what their results were. Well, this test has immediate results, so they can be told what their results are. Yes or no, you have abnormal cells on your cervix, and then it can be treated immediately. They can be frozen off with cryotherapy. This is also a very simple procedure, so that makes it very advantageous in lesser developed countries where you may not have very many resources. It is highly sensitive to abnormal cells. That makes it very advantageous because it doesn't miss abnormalities that may be present. But if we move over to the disadvantages, that causes a lot of false positives because it's not very specific to what it's reacting with, I guess, per se. It only identifies that there is an abnormal cell. It doesn't say, oh, this is why it's abnormal, or this is so progressed. So that can be an issue sometimes, in other diagnostic methods may need to be used in those situations. It also requires proper training, and then, like we were talking about, in lesser developed countries, there may not be resources for a person who is properly trained to administer this test. So comparing this with the Pap test is that it is better for clinical settings in less developed countries. Dr. Lisa Dunham is a physician who just recently started using this test, and it is worked out very well because she can use it in her mobile clinical settings and in the rural villages of Guatemala where she lives. It is less costly. It's very financially appropriate for people who are in a low-income family. It is less likely to miss abnormal cells compared to the Pap test. The Pap test is very expensive, and the way that the Pap test is administered is the cervix is scraped for gathering of cells, and then they're put onto a slide and then read. Well, if you miss the cells that are abnormal in that gathering of the cells, then you might have a false negative. The Pap test has more specific diagnosis, however. This means that you can see those actual cells and see how progressed they are. You can see where they are and the abnormalities that are present in those cells. And then it also has the ability to test for HPV whenever you collect that sample for the Pap. That vial can be used for HPV testing. So it has dual abilities there. This is a chart with the information gathered in a test run in Zimbabwe, which comparing Pap tests to VIA. Each of the women that were involved in this test had both VIA and Pap. So the light blue is VIA, and the dark blue or purplish color is Pap. So over here on the left side, this is sensitivity. As we can see that the VIA scores higher in the sensitivity areas. Both of these are sensitivity to HGSIL, which is high-grade squamous intraepithelial lesions, and then low-grade. Same with specificity to high-grade and low-grade over here. But Pap scores much higher over in the specificity. So that just means that you can see and see the specific details of those abnormal cells. And like we talked about earlier, this data just backs up what we've been talking about. So in conclusion, I was talking to you about how VIA is a cervical cancer screening method and how it compares to Paps. This can really be beneficial in lesser developed countries. We don't really use VIA very often in the U.S. We use Pap much more often. But I think that VIA could be used as a prelude to Pap for lower income families that maybe can't afford the Pap test. But this one, since it's so inexpensive, could be used to say yes or no, you have abnormal cells. And if they are present, they can be referred on to the Pap test or other diagnostic methods to treat those abnormal cells. And in conclusion, I think that this method of cervical cancer screening is very viable and very useful in our world today.